All right, let's hear more on this now from Toby Green in London. He's a professor of African history at King's College London and the author of the recently published The COVID Consensus, the New Politics of Global Inequality. Professor, as we look ahead to this second COVID summit, I want to hear your thoughts on the policies that were implemented these last 2 years by countries as they tried to control the virus. Do you think this was a case of the cure being worse than the disease?
Oh, I've got no question that it's a case of the cure being worse than the disease. The argument I make in the COVID consensus is that what we've seen is a very much top-down policies being driven around the world without any attention to the differences in health needs and even the age profiles of populations. If we take the African continent, in 2019, the United Nations estimated that the median age on the African continent was 19.8. Now, as is widely known, the average age of fatalities for COVID-19 is far in excess of that, and so it's not surprising that we've seen many fewer COVID-19 fatalities on the African continent than in other parts of the world. The current estimates are around about 250,000. This is probably an underestimate, but that's over 2 years. So we're probably talking, even if it was a half or a third, it would still be a moderate increase in fatalities on a continent where 9 million people die every year. At the same time, speaking to a colleague in Mozambique recently, all other vaccination programs have currently been halted in order to roll out the COVID-19 vaccine, even though other conditions are leading to much higher fatalities. So really, we've seen a very disproportionate response, which has had major impacts in many parts of the world, not only in health terms, but also, of course, in economic terms.
So what do you think will be some of the lasting effects of these policies?
Well, I mean, they're enormous. I mean, if we take the COVID-19 vaccines, if we take the vaccines and take the medical infrastructure, so that there's various elements of the infrastructure that we have to think about. So, for example, let's take the COVID testing program. Now, so massive worldwide testing has been widely seen as the way out of the COVID-19 pandemic. But one of the things I interviewed about 6 months ago, the former deputy director of Médecins Sans Frontières, Doctors Without Borders in Spain, Llanos Ortiz Montero, who has worked in over a dozen African countries in emergency medical response. And one of the things that's very little appreciated is that, for example, the companies which used to make malarial rapid tests diverted into making COVID rapid tests. So there's been very few malaria rapid tests, for example, available on the African continent. And there's seen a large increase, actually, in malarial fatalities, which generally affects, whereas COVID-19 affects much older people, malaria fatalities are generally concentrated in people aged 5 years and under. So there's that element of public health. There's also the element of medical infrastructure, which because of the focus on trying to eradicate COVID-19, has led in countries where it's not such a major concern as other diseases, as I've explained is the case in Africa, has led to an increase in fatalities from those. So those are large public health issues which will take many years to resolve, especially because of the increase in public debt, which has taken place because of the spending which has taken place. And now the huge increase in food prices, which we're seeing in poor countries as well as rich countries, which is having a major impact on world hunger.
And I'm sure you're following closely what's going on in China. They have a zero COVID policy, and they're refusing to budge with that. We have Shanghai, the country's most populated city, in a severe lockdown for almost 8 weeks now. And other cities also in some version of lockdown. It looks like Beijing could potentially be next. What are some of the dangers of that policy with China refusing to back down from that?
Well, I suppose it would depend who you ask. I mean, if you're talking to people in Shanghai, obviously I'm not in Shanghai. I can't really speak to people in Shanghai. What I observe is that, there is a serious problem in terms of access to food, medical supplies, and of course mental health, which is a huge issue. And I have to remember that it has never before been tried in history to eradicate a new respiratory virus. That has simply never happened. And this was a new policy. If you read the November 2019 WHO pandemic preparedness document policy, which came out of a year and a half of research at the University of Hong Kong, HKU, it didn't mention the word lockdown once. And it actually recommended that several things which have happened routinely over the last 2 years should never happen in any circumstances. It's on page 3 of the report, so I recommend that your viewers see it. It says that we should never close borders, we should never quarantine those who have no symptoms, and that we should never do contact tracing. Now, some people may say that the evidence has changed and so on, but we have to remember this has never been tried before. We don't know that it's possible. And the evidence of the last 2 years suggests that it isn't possible. So nevertheless, there's huge social, economic, and political, because of course, let's remember that China has a very authoritarian government, And there are huge political consequences to this kind of a procedure. So those are some of the risks.
All right, we'll leave it there for now. Professor Toby Green joining us from London. Thank you.